We're going to discuss shared governance and its role here at UMC and how it's leading the way for innovation and quality. So what exactly is shared governance? Shared governance is a structure that governs nursing practice. It empowers nurses at every level to make decisions related to quality, practice, and competence. At UMC, we have two shared governance structures. We have our Patient Care and Quality Congress, also known as PCQC, and we have our Unit-Based Councils, or UBC. Shared governance is an important structure in magnet hospitals. Nurses have control over their professional practice, which creates accountability and autonomy. Here's an example of our shared governance model. Notice that nursing practice is at the center of the model because we are focused on patient care. Next are the unit-based councils because it's the nurse at the bedside that controls their own professional practice. The UMC shared governance model gives nurses the accountability and ownership to make their own decisions. Now we're going to discuss unit-based councils. A unit-specific shared governance council that is represented by nursing staff. The UBC elects a chairperson to lead the committee, a co-chairperson, and a secretary. It is the decision-making body of your unit between all levels of nursing. They have the accountability and authority to change nursing practice. The UBC addresses any issues related to bedside nursing. They have the accountability and authority to make decisions at the unit level. Any decisions or issues that are going to affect more than one nursing unit are brought to the Patient Care and Quality Congress, which has the authority to make decisions at the house-wide level. Some of the changes that UBCs have made on their unit include the EC has increased their scan compliance from about 50% to above 90%. 3 West used evidence-based research to help our CAUTI rates by obtaining a UA in culture for patients that have a Foley prior to admission to UMC. The Family Birth Center Family Care Unit made changes to their staffing schedule for holidays. And the PD-PICU created the All Better Care policy to help pediatric patients during IV sticks. The Patient Care and Quality Congress is a house-wide committee that's composed of the chairperson from each unit-based council and a chairperson from each non-clinical patient care nursing department. Other members include the magnet coordinator and senior vice presidents for patient care services. The Congress meets monthly for 2 hours, and each member must have 80% meeting attendance. The purpose of the PCQC is to establish and approve practice standards that will govern general nursing practice. Standards will be evidence-based and focused on patient and family-centered care. They have the accountability and authority to make decisions on hospital-wide nursing practice. They address any issues related to bedside nursing house-wide. They make changes in policies and procedures, but they must be evidence-based, and the council may refer to other committees as needed. Some of the changes that PCQC has implemented include changes to the NG2 policy requiring X-ray confirmation and pH testing. Changes to the cognitively impaired pain scale for more accurate pain control, creation of a laryngectomy policy, and house-wide staff education. Lean daily management projects. So, what is your role as a new nurse in shared governance? It's important that you understand the policies and procedures on your unit, but also the housewide and nursing policies. You want to identify any issues that can be brought to the council, and you can always participate on council projects. We encourage every staff member to participate in their unit-based council to help make decisions about our professional practice. So you always want to follow our policies and procedures. If you ever have any questions about nursing practice, on your unit, you're going to have a skills and clinical nursing book. And if you work in a critical care area, you'll have an AACM procedure manual. These books are always there for you as a resource. You always want to look at our policies and procedures that we have at UMC. Those can be found on the UMC intranet under the Resource tab and then Policies and Procedures. If you go to the nursing folder, you'll find the general nursing policies. Take ownership of professional practice. At UMC, we want to create an environment where the expectation is shared governance. Create a culture where nurses are consistently making practice decisions, and we want to set unit goals and housewide goals to improve patient care. We're excited to have you here at UMC, and I encourage everyone to participate on their unit-based councils.